well, I guess whenever. And thanks so much for everyone who's with us this morning. Hi, I'm Megan Johnston. I'm the Executive Director of the Stryker Johnston Foundation, and welcome to our session, Hub One, Building a Trust-Based Collaborative to Maximize Impact and Improve Sector Health. So thanks again for choosing to spend your time with us this morning. We really appreciate having this opportunity to connect with you. And before we go ahead and get started, we just want to go over a few things. If you could please keep yourself on mute throughout the session unless you're speaking, that would be great. That helps to minimize background noise. And you are welcome to turn on your camera or turn it off, whatever feels most comfortable for you or is available to you today. And you are welcome to submit any questions you may have in the chat at any time throughout our session, or wait until the end of our presentation to ask questions. But we will have time for Q&A at the end. So again, if there are questions throughout the session, please feel free to put them in the chat. And if you're experiencing any technical difficulties or anything throughout the session, please go ahead and connect with the platform technical assistance. And before we get started, I'd like my co-presenters to introduce themselves. You can also review their full bios on the conference platform. So I'll go ahead and turn over to my co-presenters to introduce themselves.
Good morning, I'm Amy Kukta. My pronouns are she, her, and hers, and I'm the Chief Executive Officer for Big Brothers Big Sisters of Southwest Michigan. Good morning.
Good morning. I'm Luke Kwiaczynski, Executive Director of Urban Alliance. My pronouns are he, him, and his.
Greetings, everyone. My name is Yolanda Lavender, she, her, hers. I'm the Grant Program Manager with the Stryker Johnston Foundation.
Good morning, everyone. My name is Matt Lynn. My pronouns are he, him, and his, and I am the Chief Executive Officer for Boys and Girls Club of Greater Kalamazoo.
Good morning. My name is Danielle Saladicki. I'm Chief Executive Officer of Prevention Works, and my pronouns are she, her, and hers.
Good morning, everyone. I'm Sarah Weissar. My pronouns are she, her, and hers. I'm the president of the Impact Collective Group and a strategic advisor with Hub One.
Great, thanks everybody. And great, so before we go ahead and get started with the presentation, we'd like to do 3 brief polling questions to help us get a better sense of who's in the virtual room with us this morning. So we'll go ahead and do those. Can we go ahead and pull up the first poll question? All right, so first off, who's in the room with us? What role do you most closely identify with? If you could go ahead and pick what one you identify with. Okay, I think we have everybody. I'm going to end the poll or close the poll. Okay, great. So we have a kind of a mix of different folks in different roles here today. Okay. Oh, I'm not sure if you see that. All right, and the next question. All right, the next question is, how familiar are you with trust-based philanthropy or grant making? Very familiar, somewhat familiar, and not familiar at all. All right. I think we have mostly everyone there. Okay, so it seems like most folks are somewhat familiar or very familiar with that. So that's what we're going to be focusing on today. So we will, oh, I'm sorry, this is my first time doing a poll. Oh, sorry. I'm not sure if you can see the poll report out, but we have a mix of folks with your understanding of trust-based philanthropy. So we'll go into that more today. All right. And I'm sorry, the last poll question. All right, so if you are a grant maker, do you use a trust-based approach to your grant making? All right, and that, okay. Okay, I'm not sure if you can see these results, but it looks like about looks like about half, more than half do use a trust-based approach. So great. We'll dive into more of this during our session today, and just go deeper, and look forward to hearing any feedback around your experiences with trust-based grant making too. Okay, and we can end the polls, and thanks for your patience with my first time polling. All right, great. So we can open up the slides, and if you can move to slide 6, just review the agenda briefly today. So we will share a brief intro. We'll start off by sharing a brief introduction and overview of the Stryker Johnston Foundation and Hub One, and then most of our time we'll spend on having a moderated dialogue about our experiences building a trust-based collaborative together. And then we'll end our time with a Q&A. And again, please submit your questions that you may have through the chat function, or you can hold your questions and share them at the end. And we'll do our best to address as many questions as possible. Go to the next slide. So we hope by the end of our time together today, you will understand why and how a trust-based philanthropy approach can improve relationships, outcomes, and impacts, how shared services and infrastructure models allow nonprofit organizations more sophistication, effectiveness, and greater impact, and also opportunities to improve overall sector health by addressing key issues that inhibit impact, such as pay equity for nonprofits and the power dynamics between nonprofits and funders. All right, so the Stryker Johnston Foundation has been on a journey over the past 3 years to actively practice trust-based grant making. And we'll spend today highlighting what that means for us, and also going over a specific example of a trust-based collaborative that we've been involved in with Hub One. And for us, a key component of trust-based philanthropy is to place relationships at the center of our work, and really recognizing our shared humanity and our visions to create positive social change with our grant partners. And inherently, there is a significant power imbalance between foundations and the organizations they fund, grantees, or as we call them, our grant partners, with foundations calling almost all the shots and holding nearly all of the power, even though fulfilling their missions is entirely reliant on their nonprofit grant partners. And we believe this power imbalance perpetuates inequitable systems and inhibits nonprofit organizations and foundations from making the deep and lasting impacts that they seek. So through trust-based practices, which we'll go into more today, we seek to openly call out and question that power dynamic, and we seek to alleviate that tension with the goal to make our work more impactful, efficient, and grounded in the reality, needs, and opportunities of our partners and the communities we serve. So for us, a core component of trust-based philanthropy is listening deeply and engaging with our grant partners from a place of trust and respect. And it means having difficult conversations and necessary conversations to share how things look from our perspectives, what we may be missing, and how we can do better. When we can honestly share our hopes, our fears, and challenges without fear about the funding consequences for doing so, we create a unique space for shared problem solving and improve opportunities for collective impact. From the beginning of our relationship with Hub One, we've had candid conversations about what needs to change at both organizational and sector levels in order to work towards our shared goal of eliminating intergenerational poverty in Kalamazoo County. We've shared hard truths with one another, and we have had and continue to have challenging conversations. And through it all, we've remained committed to coming back to the table together. We hope that our discussion today provides an example of what our open dialogue for us looks like in practice, as we describe how our relationship has evolved over time and how engaging in this work has been really transformative for everyone that's been involved. And in any relationship, trust is not something that's automatically given to you. It's something that's built over time and by an accumulation of actions. And by doing what we say we're going to do, by listening, by learning, by practicing humility, and also by communicating honestly and openly with one another about what's true for us. And we have always encouraged our Hub One partners to be radically honest with us, and we've committed to doing the same. With the hope that by doing so will allow us to eliminate those barriers that hold us back from making the lasting impacts and change in our community. So with that, today you may hear some things that may be uncomfortable or challenge your view about philanthropy, and I encourage us all just to sit with and lean into any feelings of discomfort and see what we can learn from those feelings. I know that when I start to feel that way, it's usually an important opportunity to examine my own patterns and beliefs. So again, we just thank you again for joining us as we share our journey with you. And before we get into our dialogue, we'll just give you a brief overview of both of our organizations. So I'll start off with a overview of Stryker Johnson Foundation. If you can go to the next slide. All right, so who is the Stryker Johnson Foundation? We are currently the key philanthropic partner of the Hub One Collaborative, and we are a private family foundation based in Kalamazoo, Michigan. We were founded about 25 years ago by Rhonda Stryker and Bill Johnston, and our organization has gone through several different iterations, and we continue to evolve. Most recently in 2017, we updated our mission to focus on addressing generational poverty and its systemic issues. We envision a world where everyone has the opportunity to live a healthy, productive, and fulfilling life. And we partner with organizations and initiatives working to strengthen and build thriving, equitable communities. Go to the next slide. And currently we focus on investing and collaborating with organizations and initiatives working to address intergenerational poverty, specifically in Kalamazoo County. We focus on place-based investing and developing trusting relationships with our grant partners. We approach our work from a place of curiosity and are really committed to listening and working with our grant partners to identify how best we can align our work together. Now going to turn it over to Yolanda Lavender, our grant program manager. She's going to touch on a little bit more about our trust-based grant making approach.
Thanks so much, Megan. You all can advance to the next slide, please. So I'm going to, like Megan said, talk about SJF, specifically our approach to trust-based grant making. And I think it's important just to lift up that we definitely have done research and looked at other organizations that are doing trust-based grant making. So the Trust-Based Philanthropy Project is one of the resources that we've used to accumulate best practices and just lifting up different pieces that we are able to use again in our approach to trust-based grant making. And so at SJF, we've defined that as a transparent, relationship-centered approach that prioritizes trust and ongoing partnership. And we can move to the next slide, please. So this is a list of the different ways that we are living out trust-based grant making in our approach at SJF. So prioritizing relationship building. So definitely at the center, the foundation, our very first interactions with our grant partners, organizations that come to us seeking funding. It's really important that we take the time to build relationships with those individuals and organizations. Centering transparency, again, a very important part in relationship building. And so as Megan mentioned earlier, we address and acknowledge right away at the onset that there is a power imbalance, there's power dynamics at play between funders and organizations that they provide funding to. And so it's our feeling and understanding that it helps with building that relationship and centering that transparency once we acknowledge that right at the beginning. Being accessible to our grant partners, another very important part, and I would say definitely within the last 6 to 7 months, we've really been able to lean into this piece, absolutely. So this looks like our grant partners being able to reach out to us when they need to, us maintaining ongoing communication with them. And then a really important piece to to this value is that we initiate the communication with our grant partners. So we reach out to them. We seek to be able to communicate with them and find out what's going on with them, again, so that they know that they are able to access us. Leaning into flexibility, another piece that definitely since March we have needed to really hone in on. And so I would also say that this flexibility piece, not only making sure that we extend that to our grant partners, but making sure that we extend that to ourselves as well. We all know there's been so much uncertainty that's been happening around us. And so flexibility is key, very important. Again, not only for us extending that to our grant partners, but to ourselves as well. Multi-year and unrestricted funding is a pretty common piece in trust-based grant making. So this looks like unrestricted funding, allowing organizations or giving them the power to be able to request funds without restrictions so that they can use those funds in any way that they see fit. So this comes with the understanding that a lot of times it's important for us as funders to move out of the way, and knowing that our grant partners are the experts on the work that they do. And so they know the best way to be able to use those funds. And again, especially in a time of a lot of uncertainty, it provides a lot of flexibility for organizations to be able to have those unrestricted funds. And then multi-year funding, so this just provides the security and knowing that those funds will be there from year to year. Transparency about request amounts. This is definitely a piece that comes up a lot at the beginning of relationships that we're building with our grant partners. So we'll get questions about, well, how much should I ask for? How much is too much? And so we always like to let our grant partners know that they should feel comfortable with asking for whatever it is that they need to be able to efficiently do their work. And then a part of the relationship building is that we then are able to have honest and transparent conversations around those numbers. And again, just reassuring our grant partners that we're not offended by numbers and that we're always open and wanting to have dialogue with them. Soliciting and utilizing feedback. So this might look like surveys as we're having one-on-one meetings with our grant partners, asking them about their experience with our grant process. At the end of each grant period, we provide a final reflection for our grant partners. And so we're able to receive feedback that way. And then the utilization of that feedback is also a very important piece. And so while we're soliciting that information, being very open and transparent with our grant partners about why we're asking for the information and how we intend to use that. Defining partnership and trust together. So again, it's important that we as the funder, that we don't prescribe anything at the beginning of the relationship or throughout the relationship, but that we make it very clear to our grant partners that it's important for us to, in partnership, to be able to define what that's going to look like together, and that they be comfortable with doing that, and that we understand our piece of accountability in doing that as well. And then lastly, walking alongside grant partners from the letter of inquiry until. So again, it's very important for us at the onset that we develop that relationship and that our grant partners understand that we'll be with them through the entire process, several different opportunities and touch points for us to communicate. And then also it's important to note that in trust-based grant making, that doesn't always mean saying yes. And so when there are situations that there's a no or a decline, that we still are able to provide feedback and have conversation and dialogue with folks around that. And so that's the until part, that we're able to be there and walk alongside folks from the beginning all the way through. And so I will turn it over to Danielle.
I'm Danielle. Hub One, and I think we can go to the next slide probably. Well, maybe we won't advance to the next slide. Hub One began with 4 CEOs meeting over coffee and breakfast several years ago to discuss and figure out how to tackle issues that were barriers within our sector. We formalized our group and called ourselves Hub One after a little bit of time. And we consider ourselves a venture transforming how the nonprofit sector serves people and solves problems. We're led by 4 nonprofit organizations in Kalamazoo County who are dedicated to reducing intergenerational poverty. And those nonprofits are Big Brothers Big Sisters of Southwest Michigan, Urban Alliance, Prevention Works, and Boys and Girls Club of Greater Kalamazoo. And our lead philanthropic partner is Stryker Johnson Foundation. We can go to the next slide. Hub One applies a principled people-first approach that embraces equitable practices in order to achieve more equitable outcomes. And our partners with Stryker Johnson Foundation partner and collaborate on strategy and services, and we measure our progress toward a shared vision. And I'll turn it over to Matt.
Thanks, Danielle. So we can move to the next slide. So what does trust-based philanthropy really mean for us within the context of the partnership and the relationship that as Hub One we share all together, but as well with Stryker Johnson Foundation. So starts with really kind of underlining the word trust. So when we talk about trust, it's really getting to a level of knowledge and familiarity with the work that's happening in order to be able to point out, number one, where trust can really be achieved. And trust meaning really that sense of a deep knowledge and understanding of what is proven and what is to be known as having impact within the work that we're doing to really transform and transition the community and conditions within our community environment. So the investments also are really driven by the decisions that are made and how we want to put money into supporting the work that we hope to see happen and ultimately what we want to see achieved. So when we talk about what type of change comes about with trust-based philanthropy, or at least putting in that elemental context of trust, really driving how we look at not only investments, but the work to really stem from that. So we're changing the perception, first of all, and shifting a paradigm within the nonprofit sector to be less about charitable institutions working in a state of being kind of hand to mouth, if you will, to being valued really as businesses that are driving towards, number one, results. And then number two, also focusing on thriving rather than just surviving as well. So within the context of our ecosystem, you'll see in the bullet where we talk about scarcity to abundance. And really that notion of it's less about organizations or service providers feeling compelled to have to work in a state of doing more while having less resources, to now a fully engaged expectation of organizations having the ability, having the capacity to be able to work at a maximized and optimal efficiency level in order to be able to deliver on programs and services that are intended to have the impact that we look to see within and achieve within communities. So one key aspect of that, and it was hit on a little bit earlier, is a balancing in terms of a power dynamic between our funding and investing institutions and then also our service providers. So if we recognize the imbalance, meaning who holds sway many times in terms of how decisions are made or what direction we go as a community, not just with how money comes in to support services, but also what are the key identifiers of really the outcomes, the indicators that we hope to actually see change in a community. Oftentimes it may be the funders that have more sway and organizations less feeling that they have a voice in what needs to happen or how a community needs to actually rally together to see change happen. But Hub One seeks to create a balance by acknowledging that there can be a coexistence within the ecosystem of our nonprofit sector, where both funders and service providers, again, know each other, but have a healthy mutual respect for each other, are able to speak truth, are able to speak together in a way that we are working towards the same goals and the same outcomes without there feeling like that there's an imbalance in terms of who has the greater voice and who has to just now follow suit. And then finally, when we talk about the idea of smart investments, we talk about SMART goals all the time, but smart investments meaning things that are specific, measurable, achievable, relevant, and timely. So right now, what we've been able to achieve, and in the partnership with Stryker Johnston Foundation, is getting to looking at how smart investments prevail in terms of decisions, where hope is really driven to be able to get to outcomes. But then the bodies of work and the institutions are also of known quality, and what it is that Stryker Johnston does is really aid to lift up those organizations and say, these are ones that we know are working, are in a level that are able to achieve impact. I will dare say that there's also belief in that the work that is happening is the right work, and it is the right investments in order to be able to make sure that work has the ability and the resourcing to be able to achieve its ultimate goals and its outcomes, not just for any institution, but for the community as a whole. So that's when you start to work in that space, that's where you start to hit that underlying sense of trust in trust-based philanthropy. So that just gives you an idea of what it means for us in terms of the use of the term trust-based philanthropy. But I'll turn it over to Sarah now to kind of take us into the next section around maybe questions and any comments. So thank you, everyone.
Thank you, Matt, Danielle, Megan, and Yolanda for providing this important background for Hub One and the Stryker Johnston Foundation. Reggie, thank you for sharing your screen. I think we can go ahead and close the slides for the upcoming portion of the presentation, please. Thank you. It's a true pleasure to be with you all today. As I shared, I'm Sarah Weissar, and I have the honor of working with Hub One and the Stryker Johnston Foundation to help bring this important initiative to life. As Yolanda and Matt shared, the trust that we have established between the foundation and Hub One is a defining element of our work. We're so grateful for the Stryker Johnston Foundation's commitment to pursuing this kind of relationship with the utmost integrity, and feel it's really paramount to our success and our ability to achieve effective impact. Today, as Megan mentioned, we'd like to illustrate how the unique nature of our partnership guides our decision-making and the way we shape all aspects of our work by sharing more about our organizations, the collaboration, and our experience through an open dialogue together. So I will pose questions for the speakers to answer from both the nonprofit leader's perspective from Hub One and from that of the funder, Stryker Johnston Foundation as well. And as Megan mentioned, as we move through the dialogue, feel free to post your questions in the chat feature, and we'd love to include you in the dialogue later in the presentation. So let's dive in. From the nonprofit CEO's perspective from Hub One, how did the idea for Hub One come to life?
Hi, good morning. I can speak to that. So actually, it began exactly 3 years ago at the CMF conference, which I believe was in Detroit. At that time, I met Luke, and we started a conversation about our concerns and frustration with nonprofit pay and our inability to attract and retain quality staff because of the pay. We recognized that many, if not most, of our staff were living at or above the poverty line, and really we were unable to increase pay due to basically market share and market expectations dictating what those ranges should be. So that began the conversation. When we got back to Kalamazoo, Luke pulled together a few other CEOs, and we met a few times. And as the conversation evolved, we discovered we had some other shared concerns and barriers. There at times were dynamics between boards and funders which limited our functioning or caused frustration. We found that we were unable to be proactive and strategic. We were constantly in reactive mode due to staff turnover and due to low funding, and constantly starting over at the beginning of each fiscal year, worried about whether or not we'd be able to make it through. And I think it was Luke who said, who of us will be here in 5 years? And nobody raised our hands, because that indicates really how burnt out we all were. So it was Danielle who actually said, okay, are we going to actually do something about this, or just really talk about it? And we decided we wanted to take action, that we all believed in our mission passionately and needed to be here. So we did a 2-day off-site session, so we were able to really kind of clear our minds and invest in the process. We started by developing trust and shared understanding of our purpose and goals of being there. we started charting out what each of our agencies did, and we began to see an alignment and affinity with our services where if they were combined, they would actually complement each other to help families who are experiencing intergenerational poverty, as opposed to overlapping or conflicting. So that was kind of our first aha moment of, hey, we have these services, and if they were better aligned and better in partnership, we could make better impact. But we also began dreaming and thinking about a new type of collaboration. Typically in the past, when we've seen collaborations, it's driven by funders. So the funders have a great idea and have a lot of passion and will provide funding and ask agencies to come forward and collaborate. And I think the neat and unique position or unique example of Hub One is we came together first with our mission and our passion. And then we were able to partner with Stryker Johnston Foundation to really take our vision and our dreams and make it reality. So we spent that time, we developed trust, we came up with the framework for Hub One. We had about a year of conversation with Stryker Johnston Foundation and really reflecting back on what they've pointed out about trust-based giving. I can say this was really a perfect example. We were able to ask tough, scary questions. We were able to work with them for a proposal that some might have considered off-putting or daunting. And they really walked alongside us as we developed this plan and project, which made it that much more powerful and impactful, I would say. So, interestingly, 3 years ago, we were at the Council Michigan Foundations Conference, and it all came about from there, and just thrilled. 3 years ago, I never would have dreamed that we would be where we're at today. So very grateful for my other Hub One directors, and also the partnership with Stryker Johnston Foundation, particularly over the last 7 months with the pandemic. I would say we all, based on the trust we've developed and the relationships, have really encouraged and enabled all of us to keep leaning in every day and doing the work we do. And I feel fairly confident that at least I wouldn't be doing as well as I am if it weren't for this partnership and support. So thank you to my peers.
Amy. Sounds like quite a journey over the last couple of years. Thank you for sharing. From the Stryker Johnston Foundation's perspective, what was so appealing about Hub One that led to the significant conversations and ultimately funding for this partnership and collaboration?
Hey, thanks. I can speak to that. And there were a number of different things that went into our decision to join as a partner in this effort. And as Amy mentioned, we were in conversations with the Hub One collaborative for over a year before we moved into a formal funding relationship. And I think what struck me most about this collaborative and this endeavor is just that intentional deep relationship building that they had been doing from the onset before even inviting us into the conversation. And it just felt like such a different approach to collaboration that I had not often seen or experienced, and knew that there was just that deep, they had already established such deep trust with one another, and invited us into that as well. Their commitment and passion for sector-wide change, I think we are really struck by that, by really the systems change approach that they were taking, both looking at organizational level and the sector level of how we could really address these barriers that are holding us back from really living into our missions and our mandates. And so that was really inspiring to us, and they were bringing up some of the challenges and things that were coming up for them, some of which Amy had mentioned, really resonated with us. And we saw this as an opportunity to use this as like a pilot to look at how we could really transform the way that we're doing work in order to get the results that we are all searching for. And this approach felt different, and it feels different. And that really started from the onset and continues to evolve.
Thank you, Megan. It sounds like there's so many unique elements of this. I'd love to focus on the partnership element of that. For Hub One, how would you describe the partnership between Hub One and the Stryker Johnston Foundation, and how is this different from relationships potentially with other funders?
I can grab that one. Thanks everybody for laying such awesome groundwork. Describing the partnership between Hub One and the Stryker Johnston Foundation, I think it's fair to say it's more than just a partnership. It's a shared commitment, work together. It's a shared commitment to build trust and operate differently. There's mutual respect. There is really significant truth telling that happens. one of the things in the sector that we realize is we don't have enough of those honest, scary conversations, that we kind of tend to play it safe. And this work, to me, is about being brave on both sides, about stepping in and leaning in and creating that space where we can talk about the real issues. We can get to the root cause of the problem. We can pick up the phone and say, that was uncomfortable. We didn't like that. And it's not an indictment. It's more of an invitation to step into something that could be better. But it requires us all to be brave. And I think this partnership, and collaboration is all about that, is stepping into that, what is more. And it really is, we see it as a collective mission that falls on both of our shoulders. We can't do this as just the sector or the nonprofit portion of it. We need support, we need foundations to join us in this. And so it's about working together on that and recognizing the shared mission. As far as what's different, all of the things listed above, but I think with the Stryker Johnson Foundation, this partnership, it feels like we have a co-conspirator. We have somebody that's alongside us in talking, and we're working on this together, that it's not in any way adversarial. It's all, we can do more, we can do better, because we care about solving intergenerational poverty. We care about making a difference, and we're willing to step into that uncomfortableness together to push for more. And if I had to sum up, the biggest difference between this relationship and other relationships is the call to the Stryker Foundation Stryker Johnson Foundation is the call that you don't have to prep for. You can pick up the phone and have a conversation, and you know that there's enough trust and respect there to have that conversation in a raw form and a not prepared form, and move on from there. And it's really, for all of us, I can say it's life-giving, and it's energizing to know that this exists, and we're excited to see where it goes.
Thank you, Luke. We're all excited to see where it goes. Megan and Yolanda, I know you've shared Stryker Johnson Foundation's full commitment to trust-based relationships. Can you please tell us more about the benefits of promoting trust-based relationships with all grantees, or how this has evolved over time? What's different?
Yeah, so I would say, I definitely echo a lot of the sentiments that Luke lifted up. And again, our approach to grant making overall is trust-based. And so we seek to have that and build that relationship with all of our grant partners, but definitely with Hub One, I would say the relationship is a lot more involved. And so again, each of our relationships with our grant partners are different. And so this relationship is definitely no different. Of course, we're communicating regularly with 4 different nonprofit CEOs, and they're leading 4 different organizations. And so that requires that our communication is tailored to that. And so I would definitely say that that's a huge piece that is, a difference between other relationships that we have. And then I would also lift up what Megan mentioned, that the collaborative nature of this this organization, Hub One, is just something that, I personally had never seen before entering this relationship. And again, the way that trust and collaboration was built among the 4 organizations, even before the Stryker Johnson Foundation was invited to partner on this work, again, is just something that is not regularly seen. And so I think that is a really important part as well. And then again, just really, as Luke mentioned, being vulnerable and really seeking the opportunity to come to the table each and every time that we're having a conversation from a place of transparency. When there's tension or hard conversations that are happening, being okay with sitting in that and maintaining that transparency, even in those moments, is definitely a piece that has been important as well. And then, much like Luke mentioned, not needing to prepare or, come in a certain way to any of our dialogue or conversations or interactions with one another. I would say from the Stryker Johnson Foundation side as well, it just feels really good. Also, to be in a relationship that is transparent, where you don't have to do that. And we can just, keep it real with one another in all of our engagements.
Thank you very much, Yolanda. I want to revisit this idea. There's such a theme of uniqueness. Matt, I know at the beginning, so I'm going to throw this one to you if that's okay. You spoke of some core tenets of Hub One and the commitment to trust-based philanthropy. Is there anything you'd like to add about what Hub One is doing differently or the unique nature of Hub One's approach?
Yeah, absolutely. I think it's certainly been illustrated within a lot of these stories that have been shared. But, when I think about what makes Hub One unique and of value, and certainly what makes it different, is something really that Amy had alluded to in her dialogue. And it really was the origin story, of Hub One, and the fact that many times collaboratives are brought together for short-term solutions. So you have a short-term design to them, and who is it that really is the one that's driving the all call for organizations to come around the table? It's an investor, or it's a funder. So people come with the expectation that money is going to be automatically on the table. And then all of a sudden now you create struggle points and tension points. And maybe that collaborative doesn't last, or it's not as strong because it isn't organic. But the fact that Hub One stemmed from organizational leaders saying that they had a recognized challenge amongst them all, and then daring themselves to say, we could either, number one, go down the road of giving lip service, or we could actually do something about this, was really the thread that's held Hub One together this long. The fact that they've given themselves time to create guiding principles, to live in a space where there is full and complete transparency. I know just as much about the other organizations that I partner with as they do about Boys and Girls Club. And that's significant in terms of it took time to be able to get to that point. And it took building trust, and it took learning how to be curious with each other and how to be transparent with each other. And there's also a willingness to really sacrifice in this as well, that you are not necessarily driven by your own self-serving interests any longer. What's in it for me? And if I don't see what's in it for me, then maybe I pack my things up and I go home. But staying committed to saying there is a greater good that we're looking to achieve, and that is what's going to hold us together. And being able to affirm that is a foundation, for everything that we do and what Hub One stands on. What I really appreciate is the fact that in the conversations with Stryker Johnston, there was a flipping of the script where Stryker Johnston Foundation did not say, we don't feel like you're ready for an investment, so you come back when you're ready. But it was really this group saying, we don't feel like we're really ready, to be able to attract money right in the onset and then be able to know what to do with it. So there was just a growth pattern within those conversations where we got to the point where there was an equal understanding between Stryker Johnston Foundation and Hub One, and even maybe going away from there being a divide to really now evolving the partnership, where we all came to one accord to say, now we're ready to move forward. And now we're ready to be able to look at how we can use the infusion of invested support to move all those different shared elements, shared IT, shared infrastructure, shared resources to a place where this collaborative can stand for the long haul. So I think that's what makes it unique and different from many other collaboratives, is just how it's come together and how it's lasted this long.
Thank you, Matt. That's wonderful. I'd like to take one more minute to further explore the Hub One work and model. So we've talked about, and Matt, you introduced at the beginning, the SMART goals and thriving versus surviving. I wonder, from the Hub One perspective, how do you hope the work of Hub One will change the experience for those that all four organizations serve in our community?
Sure, I can address that. So, when you consider those that we're serving, it's people who are coming to us because they have a significant need or they're in crisis. So they're under a great deal of stress, they're looking for help. And traditionally what happens in the system through lack of capacity, lack of staffing, is people will access one point of service, but then as they need other identified services, there's really not someone to help walk alongside them and get them connected. So typically, let's say if someone has a mentor in my program and they need food assistance, if staff doesn't have capacity, they might say, well, here's a number to a local food bank, as opposed to actually facilitating and making the connection for them, removing that barrier. So what our plan is to have one point of service so that people aren't having to tell their story over and over again, especially as people are going through trauma. The more times they have to explain it to a service provider and develop that relationship, the less inclined they are to have the energy to fully engage in a service. So really our goal is to make it as effortless as possible. With one point of entry, we will get to know the family and their needs, and then we'll have a staff member who we're calling a navigator who will walk alongside the family and will ensure that they are able to open the doors to each service that the family needs through an identified process. So hopefully this will be a little bit different. As I said, as families are experiencing stress, it can be very daunting to think, oh my gosh, okay, here's one agency, but I don't know how to connect with them, or here's another one. And sometimes people can become frozen, not through any fault of their own, but just, I think, through exhaustion and stress. So our goal really is to make it effortless for families to be able to access all of our services. And then as needed, they will receive support and ability to engage with other identified services to provide a continuum of care, really to drive long-term change. So we want to make sure that we're providing families exactly what is needed based on an assessment, as opposed to just kind of hit or miss services here or there who might get at, some specific issues, but aren't really addressing the core issue of what the families are dealing with. So I'm very excited to see this model happen. I know it's been tried before with some levels of success, and I'm just really optimistic about our ability to engage our families in a productive way and allow them to feel safe and supported in the process.
Thank you, Amy. I think especially now it's really exciting to learn of all that you're doing to break down the barriers and really support people in need in our community. Follow-up question for Hub One: how do you hope this partnership and the work of Hub One will change the nonprofit sector as a whole? I know we've talked about the service side. Let's look at the sector side. Danielle, would you mind speaking to that, please?
When we got together, we started to look at the different spokes of work within this project, and we realized fairly quickly that one couldn't be tackled without the others, that to be effective in our sector, we needed to tackle multiple spokes of work. So as an outcome, I think we hope that we're able to reimagine and operationalize trust-based collaborations and partnerships so that people can access our services in the best way possible. And I think we're hopeful to engage with trust-based philanthropy in a new way and break down some of those dynamics that prevent our sector from doing our very best work. And lastly, I think we hope to elevate the sophistication of our organizations with shared infrastructure, resources, increasing pay equity to retain talent, and increase the efficiencies for serving people within our community.
Thank you, Danielle. I'd like to pose the next question to both the Stryker Johnson Foundation and to Hub One. So let's start with Megan and Yolanda. For the Stryker Johnson Foundation, what's the primary lesson learned so far throughout your partnership? And what has been the greatest challenge in undertaking this work?
Right, I can jump in on this. So we've had a lot of lessons, I think, throughout this partnership, and continue to learn more really every day through this. But I think one of the important lessons we've learned in this one of the things that stands out for me is just really that importance of ongoing transparent communication. I think we've said this multiple times, but it's just really, it's easier said than done in practice, and always coming back to the table and just really remembering that what is that reason why we're doing this work? What is our intention? What is our focus when we start to get caught up in different aspects of things where we may have different opinions or different views, or ways that we would approach things differently, or things land differently for us. And so I think just always coming back and, pointing out this doesn't make sense to me, or this didn't feel right, or, whatever it may be, just that importance of the ongoing communication, I think has really, this partnership, just due to the, as y'all kind of the complexity of it, has really kind of reiterated that for us. And I think a challenge that continues to come up is just really for us from the foundation perspective of just not falling into old patterns of practice. And even though we talk very openly about being trust-based, and we talked about those principles, sometimes it's difficult to not, or to, it's easy to fall into old ways of thinking and doing things. And so it's always keeping ourselves in check with that. And even in this case, I think that, you know, even our board, who is very supportive and fully on board with trust-based giving and or grant making and committed to that. When it comes down to it, sometimes it's hard not to question things, or to really, when we're talking about shifting power and shifting dynamics, when it comes down to it, that can be challenging. And it really forces us to stop and question and question, is this really, are we really being trust-based right now? Are we really not operating from a place of skepticism, from a place of where we know what's best, and we don't know what's best? So how do we put aside those those old belief patterns and really engage in this from a place of being in relationship? And what does that look like? And when we do have questions or things, how can we come together? You know, in prior to when we made the funding decision, we all joined together as a full board, staff, and the Hub One Collaborative, and had an open, transparent dialogue about all the questions that we had about this work. And I think that that is kind of a powerful example of us all leaning into that discomfort, and we continue to do so. But we're all learning, we're all trying, and being in relationships is messy. So so those are just some of the things that come to mind when thinking about lessons and challenges.
Thank you, Megan. I think that's such an important reminder, even once trust is built, that it's a daily discipline to revisit your values and make sure that everybody's living into them and that you're aware. I think that's really important. Thank you for sharing. From the Hub One perspective, are there additional thoughts on the lessons learned so far, or other thoughts on the challenges?
I can jump in real quick. I think Megan summed up so many of them. You know, it's a day-to-day thing of making our choices, and stepping into this new way of operating. And when you've operated in one way for so long, it's really hard to pop out of that rut and stay out. I think the challenge, and one of the challenges that we see as we keep leaning into this work, is just how much these patterns in philanthropy and nonprofit sector, how they've created ruts, and how as nonprofits, we're all kind of conditioned, I guess, to think about who gets the credit for the work, and who gets to report the work, and how we're getting funded, which focuses on our agencies as opposed to the needs and the good of the community. And so it's just a conscious, sometimes a daily exercise for all of us to say, no, this isn't about who gets the credit. And it takes, back to those brave conversations, it takes open dialogues with your partners to say, this is about the work. This isn't about my agency or your agency. And that's just, I mean, it's a challenge, and it's a lesson, and something that shows up almost every week in some form or fashion. And so just keeping that on the forefront, that we're cutting a new road, so to speak, and we need to live into that continuously.
Thank you, Luke. Once again, I want to have the following question posed to both the funder and the nonprofit leaders. So we'll start with Hub One, if we can start there. How does equity play a role in the work of Hub One and the partnership between you and the Stryker Johnston Foundation?
That's a great question, Sarah. For me, anytime you apply an equity lens to any body of work, what you're really stating is we're seeking to understand, identify, and then ultimately work to disrupt tendencies and norms that may exist. When you think about this dynamic partnership amongst all of our institutions around Hub, we're really talking about how do we disrupt those long-standing norms and those tendencies that function within our sector that create a business as usual mentality and mindset. And not only the business as usual doesn't necessarily lead us to looking at and embracing opportunities for honesty, for clarity, for even innovation and creativity to exist. We get caught up in the chasm of everything as long as things are status quo, everything is fine. So for me, I think when we talk about the dynamic of equity within the work of Hub One, it is giving ourselves the opportunity to really look at things differently, to garner a sense of curiosity and wonder about answering the question, why? You know, why is it that we as a sector give over to just too often business as usual? And how do we disrupt that mindset? And then also the actions to follow. And you do that through seeking difference in terms of how we can shift and change things, how we can seek to embrace truth in terms of the work that we do and being able to speak to that. How do we disrupt and dismantle the notion of fear that too often prevails within our work? But ultimately, I think all of these organizations are a great example of this. How do we find commonalities in terms of what we want to achieve, how we want to go about achieving that, both within the bodies of our organization, but also ultimately for the people that we serve and the people who are a part of our community. By doing that, now we are talking about not just getting to a place of equal, but equity and inclusion really being the drivers for ultimately what holds us together in this collaborative work.
Thank you, Matt. I think that's an important reminder for us all in Hub One and beyond. Megan and Yolanda, do you have additional perspective to provide of how equity plays a role in the work of, in the partnership between you all through the perspective of the Stryker Johnson Foundation?
Definitely, Sarah. I'm happy to speak to that a little bit. And I would, absolutely lift up much of what Matt has already provided around equity. And I would just add that, for us, again, our approach overall to our grant making is trust-based. And so it's been our experience that it really is impossible to lean into that trust-based practice without using an equity lens and really centering equity in that work. So I think of trust-based grant making and focusing on equity or having equity show up in that work as, going hand in hand. And so I think about, especially within the relationship and partnership that we have with Hub One, I think about using an equity lens when thinking about funding, thinking about equitable pay for folks, using that lens and thinking about racial equity, financial equity, all forms, and being very, clear and concise about what that looks like. So definitely just an integral part, again, to the trust-based approach and the relationships that we have with Hub One. It really just feels impossible to really be able to center transparency, come to the table from a real place of accountability and holding one another up in that without using that equity lens.
Thank you very much, Yolanda. Very powerful from all sides. I'd like to turn it back to Hub One and ask, what is an example? I think oftentimes we talk about these very, very exciting and ambitious goals. What's an example of impact or accomplishment you're celebrating already?
Sarah. I think we've had quite a few. It feels like the train left the station last fall and we've been on a freight train ever since. But some of the things I think we're most excited about, one, I just think this relationship with Stryker Johnson Foundation, I think it's been said multiple times, but it feels different and it feels refreshing and it feels healthy. And I think for us, that's hugely important to be able to do our work in the right way. We did align pay bands and pay equity for all 4 organizations, and this is helping to reduce turnover and retention and repeated training, and also allowing us to build relationships with our clients long-term, as opposed to having our clients having to form new relationships on an annual basis due to turnover. Throughout this, and a little bit, it sped up during COVID, I think, that we're doing a cross-organization operations audit to identify opportunities where we might be able to share infrastructure such as legal, HR, and other resources that make our organization more effective and efficient. And again, during COVID, we were all able to access banking and legal to apply for PPP loans and order PPE. And I think that it really highlighted how important it is for us to partner and how all 4 organizations would have done that all separately and wasted resources, and we were able to do it together. In addition, the shared service pilot that Amy spoke about, we're so excited to be able to serve people in a different way. And we know the barriers that they're facing. And this model where we walk alongside and help people navigate the barriers within our systems, we're hopeful that this is going to lead to just an amazing outcome and a reduction in intergenerational poverty.
Sounds like you've been very busy. Congratulations on all that you've accomplished. It's really exciting to hear the path that you're paving. For the Stryker Johnson Foundation, what are you most excited for moving forward and continuing to build the partnership and the collaboration?
So I think it's just so exciting to hear of what it's been accomplished so far, and so I think there's a couple of things there's many things we're excited about, but we're excited to see how this work changes these organizations and the sector as they drive for greater impact and change. And just hearing from Danielle, that brief summary of what they've accomplished so far, they've really, it's amazing and it's exciting and it's energizing, I think, to see, for all of us to see what's been possible through this collaboration and through these resources and being able to really dream and imagine differently. So that is incredibly exciting. And so I'm really excited. I am thrilled to see what has transpired so far and where we're going next with this. And also I'm excited to see how this changes us. And I think just we've said many times, this really forces us to lean into our commitment to trust-based practice. The complexity of this, the investment size of this, it's really forced us to, not forced us, but encouraged us to live into those values and really sit on the same side of the table as our grant partners. And I think that applies with lessons that we're learning through this collaborative, we apply in every other relationship that we have with our grant partners. So we see this just as a great, we're excited to see how this work will unfold and change us and change the work that we're doing in the sector.
Thank you, Megan. Thank you for sharing so candidly the perspective of the foundation. From the Stryker Johnson Foundation's perspective, what's one piece of advice? I want to make sure we have time to get this in because I think this is a really important point. What advice would you give to other funders in this space who are curious about collaborations and the trust-based approach?
Yeah, I can speak to that. So I don't know that I would frame it as advice, but I can just say, one of the learnings that I would lift up from our experience so far with Hub One is that, again, in wanting to really be intentional about using a trust-based approach, centering that transparency, building those relationships, it really requires that the foundation of those relationships and interactions are not built on skepticism. And so, just going into every conversation and all of the ongoing communication, always coming back to that place. And then also, I think I mentioned this earlier, just remembering and trusting that the organizations that we're working with, these dynamic CEOs that are part of Hub One, they're the experts on the work that they do and that they've been doing. And so it's important for us to move out of the way, which, I'm learning even in just a year of being in philanthropy can be difficult because a lot of times, as funders, we will think that, we have all the answers or know it all, and that is just not the case. And so being humble enough to recognize that and then making sure that we move out of the way so that the organizations, the folks at Hub One are able to really have the space to do the work that they want and need to do for the community. So those would be just a few of the learnings that I will lift up.
Thank you, Yolanda. That's very helpful. From the Hub One perspective, what piece of advice or learning would you share for other nonprofit leaders in this space who are curious about collaboration and the trust-based approach?
Yeah, like Yolanda said, I don't know if it's advice, but I think that we adopted some mindsets. First of all, I think we were able to dream big, and I think that that's not common in our sector. We're often functioning from a scarcity mindset and we're not able to dream big, but this project came out of dreaming big that we can do better, we can trust, and we can tackle hard things. I think a big thing for us is we put our egos at the door. We do that every day. We have to be disciplined to do that. We came together thinking about what we can do together better. We actually came together putting people first. If we dropped all of that stuff and we put the people first and serving people, how could we do this differently? And then I think another thing, like I talked about, was really adapting an abundance mindset. We've been functioning in scarcity mindset for a really long time, and it impacts how we serve people.
Thank you, Danielle. All wonderful insight. Thank you all for participating in a dialogue. Megan, I want to turn it over to you for a few closing comments on this portion of our conversation this morning, please.
Great, thanks, Sarah. So, as we've spoken about today, we feel really strongly that this work is really made possible through that trust-based approach, that working in direct partnership, the trust-based approach has really propelled this, or at least from our perspective, has really propelled and strengthened the work and has really energized everyone about what's possible going forward. So we're really grateful for the opportunity to walk alongside one another on this journey as we explore different ways of being with each other, a different funder and nonprofit dynamic, new ways to operate our organizations and improve service delivery, all really focused on that shared goal of eliminating intergenerational poverty. So I'm really grateful for this partnership, but really it's given us, it's been such a great, I guess, case study for us of really putting this to practice. And I think what we've seen so far is that this approach really has propelled this work forward. And if anyone's interested in learning more about this work or about Hub One or Stryker Johnston Foundation, please feel free to reach out to myself if there's things that we can't get at today in the Q&A. If there's there's only so much we can touch on in this brief session, but we're all really would be happy to share more or share what we're learning or what we're coming up against, and would love for anything that we've gained through this to be of service to others as well. So thank you.
Thank you, Megan. We'd now like to invite all of you in the audience to participate in the dialogue with us. I see that there are a few questions already in the chat function, so we will work through those. If you do have questions that you would like to ask us directly, you can raise your hand in the participant feature, but we'll start with the ones already in the chat feature. Please continue to add questions as we move through these, and we'll answer them as time allows. So this is from Stephen, and it's for the Stryker Johnston Foundation. Do you have stories of how the desire to trust grantees has caused the foundation to alter or change policies?
Thanks. That's a great question. I think I think it's really caused us to alter and change a lot of things. We pretty much overhauled our entire grant making system when we started to embark on this approach, changing the way that we take applications, how we do outreach, how we what types of things we fund, dollar amounts. We previously had I think would only fund 5% of a budget. That has since we have lifted those restrictions because we wanted to have we wanted to have an honest conversation about what was the true cost of doing the work that is proposed. But we really have shifted everything that we've done. And I think all of the things that whenever we're approaching making funding decisions or looking at policies around how we're running our grant processes, we're looking through that lens of like, is this centering trust? Is this actually trust-based? And often that question comes up in our board meetings, like, are we really trusting our partners in this decision? And so I'd say it's become a real lens that we really make all of our decisions through, but recognizing that there's lots of policies that or internal board policies and things that we do need to change. I think that this is an ongoing process. It's not something we're probably ever going to reach the end of. It's a practice. It's it's, you know, a philosophy of being in this. And so there's always more work to do. We're always learning. We're learning from others who are doing this. We're learning from what our partners tell us, and just we're committed to the practice. So we'll just continue to be reflective in that. I'm not sure if there's anything else you would add to that, Yolanda.
Yeah, I would just lift up again that there's no end point. So we're, going to be continuously making those adjustments and shifts and changes. And then I guess just a story or example would be, we even have been revisiting the way that final reflecting or reporting, some folks might know it as, the way we receive that. And so even looking at just having dialogue with our grant partners, as opposed to having them fill out a document and turning that into us. But again, just adding an additional touch point to be able to have those conversations and engage with our grant partners that way.
Great, thank you, Yolanda and Megan. This question is for the Hub One group. How do you explain Hub One and your relationship with Stryker Johnston Foundation to other smaller nonprofits?
Oh, I can jump in. I think it hasn't come up a ton. It's come up a couple different times where people were asking us to understand, what we're doing. There has been a comment or two of like, well, you guys have this and we don't. But the conversation really is twofold. One is always an encouragement for smaller nonprofits to kind of step in and start dreaming big and acting with an abundance mindset. It's really, for me, this whole process has been, I think, eye-opening as far as we have to imagine what the possibilities are to even start going on there. So there's a lot of encouragement that goes along. There's also a lot of support that goes along that we've talked with nonprofits when they're going through stuff of, hey, they come to us with a problem, or we have a conversation and we're like, well, here's a resource that we can help, or here's how we can help with this, and really sharing the power of that. Going through this pandemic that we have, I can say that the relationships that we have in Hub One, supporting each other, was one of the most valuable things. That you had somebody to call, you had somebody that was going through something similar, that was going to hold space and confidentiality. And so we've really tried to be that more than just with Hub One, but with all the partners out in the community, and really living it out. And then I think lifting up the voices of the other nonprofits because of the power dynamic that exists out there. We often have nonprofits telling us like, well, this was something that was going on. And because of the way that we've chosen to operate and step in brave spaces, we've picked up some of those conversations and helped them address some of those issues. So it's really been a shift that we're not opposed or we're not against. This isn't something where we're all, as nonprofits, kind of battling each other. We're battling a problem. And so the conversation has really shifted around to how can we do this together? How can we support them? I know there's specific examples of smaller groups that have reached out to Hub One partners. Hey, we need help with this. And we try to be the partner that we want other people to partner with us and be that example. So we really try to support and lift up and help align behind whatever their issues are.
Thank you, Luke. A follow-up question. Do you evaluate trust and relationships as part of the evolving organization's sense of what trust is? How is this achieved? And are there quantitative measures that typically go along with your grant making in this space? Megan or Yolanda, do you?
Sure. I just want to make sure I'll reflect that question back. So how do we evaluate trust and relationships as part of our sense of what trust is? And that is definitely evolving. I think Yolanda had mentioned that when we are in relationship with a grant partner or collaborative, we at the start, we start to develop, what is this relationship going to be like? What is our partner? What does our partner want from this? Some partners don't want us to be involved, and they just, and in that case, that's completely fine. Some want us to be really highly involved in the process. I'd say this is an example of that. So it's really approaching every relationship individually. It's looking at, what does trust mean for us? How can we establish that? And I think we always start by establishing trust with doing what we say we're going to do, by being and just continuing to show up and to follow through and show that commitment. I think that builds trust, and to just be try to set the tone that we can bring our full real selves to the table, whatever that is, and that we can and then we build it from there. But of course it does evolve. I think when we started this, we probably had a different idea about what trust relationships will look like, and we quickly realized that it will look different for everyone, and that trust is going to be defined differently for everyone, and everyone is coming to these relationships with different experiences with other funders, with past and that we need to start, we meet each other where we're at, and then our relationship will evolve based on what each other needs in those moments. So that's a really mushy way of saying, like, it depends. And yes, it constantly is evolving. And do we have quantitative measures that typically go along with your grant making process? We have intentionally kept our process pretty open in terms of being, we want our grant partners to reflect back to us what are their goals and how are they meeting them. We don't want to set we have chosen not to set the indicators for them. Our philosophy is that they know their work, they know their communities, they know all that much more than we do, and we wanted to give them the space to tell us what they want to achieve, how they want to achieve that, what are the indicators that are most important to them. So we really, again, similar to how we establish trust, it's a one-on-one situation with each of our partners. And then from that, we do, Yolanda has very frequent communication with our grant partners, and we're often checking in, learning from them what's working, what's not working, how can we support them in that, and then lifting up those learnings and those lessons that we're gaining. But this is evolving. Again, this has been, we're early in the process of shifting our whole grant, our entire grant process towards this approach, and still determining, well, how does data fit into that? What kind of information do we want to collect from our partners, both qualitative and quantitative? What's the value in that for them and for us? And so that's evolving.
I can add to that a little bit from the Hub One perspective, Megan. When we sat down to look at this entire project and the magnitude of the different spokes of work, we kept coming back to with our evaluators, how do we quantify this, right? How do we see success 3 years from now? And one thing that we really kept coming back to were these principles that we adopted in the beginning of our relationship with each other. And one of them was trust, but we have other ones as well. And really are looking at an evaluation called principle-focused evaluation. And so that is really going to be paying attention to where these principles show up in this work, in the shared service model and in our meetings and our relationship with Stryker Johnston. And one of the huge ones is trust. So as we take a look at this new evaluation approach, I'm hopeful that we'll have some case studies and some ways to measure where trust had a huge impact in our project and our work.
Thank you, Megan and Danielle. I'm not seeing any additional questions at this point. Are there any additional questions from the audience that we'd like to ask Hub One or the Stryker Johnston Foundation at this point? You can raise your hand. Are there any additional thoughts from the Stryker Johnston Foundation or from Hub One that you would all like to share?
Yeah, I can jump in, Sarah. I think, first of all, just an appreciation for everybody joining in the conversation today. I think for me, what I'd love to do is offer just an opportunity and a challenge, to all of you that, you're here, one, because maybe you were curious about the title, but also there's something in you maybe that said that there's something more, there's something that we can do, better from our position as working in foundations to support what we all want to see happen in changing an environment and conditions and in livelihoods for people. And I think the encouragement for me would be to step out in your own curiosity and in your own not fear, and not wait, for not organizations to come to you and say, we need to have an honest conversation about how things are going. For you to be the initiators of that and say, talk to us about, what it is that you're experiencing. There certainly is a lot more volume in what's not said than sometimes what is said, right? And if you're able to glean anything today, that having those honest conversations and creating the platform that starts to build towards trust can happen from anyone. It can happen from you as well. So I encourage you to be also sometimes those initiators of those real honest and earnest conversations that can really open the door wide for seeing the type of trust that we've talked about, the type of change that we've talked about, but ultimately, how are we working better together in one accord towards trying to get ultimately to that grand vision of what we want to see in our community as well as in our state.
Thank you, Matt. I know we have a busy week of conference meetings and all kinds of other things. Thank you for spending your time with us today. And thank you to the leaders of Hub One and the Stryker Johnston Foundation. It has been an honor and a privilege to get to work with all of you. And I think I can speak for the audience. It is very inspiring and exciting to learn more about the work that is being done and the hope that you're providing for a stronger future. I know everyone has a busy day ahead. We encourage you to continue to engage on the session page. You can download additional resources and provide an evaluation of today's presentation. I hope you have a great rest of the conference, and please feel free to forward any additional questions our way if you have them. Thank you very much, everyone.